Hey everyone, welcome back to another deep dive.
Oh, yeah.
This time we're tackling DBT.
DBT, that's
Dialectical Behavior Therapy.
Dialectical Behavior Therapy.
Right.
You know, the one that's supposed to help you manage your emotions? We found this really interesting piece from Hibernium Therapy.
Oh, cool.
It's part of their multicultural counseling services.
Okay.
And they break down what DBT is and like who it can really help.
Mm-hmm.
So if you're someone who feels like you're
Yeah.
always on that emotional roller coaster,
Oh, yeah.
DBT might be your ticket to a smoother ride.
I like that.
So let's get into it.
Okay.
What exactly is DBT?
Well, DBT, it was developed by...
Oh, I think I read about this.
Yeah.
It was
Dr. Marsha Linehan.
Dr. Marsha Linehan.
Back in the 1980s.
Okay.
And initially it was for
Yeah.
people with BPD.
BPD, borderline personality disorder.
Yes.
Right.
But the really cool thing is it's
Yeah.
evolved.
Okay.
So that it can help people with a whole range
Oh, wow.
of challenges.
Like-
Like anxiety, depression, self-harm,
That's...
substance use disorders.
So it's not just for BPD anymore?
Nope, not at all. If you struggle with like really intense emotions
Right.
that lead to behaviors that are causing you problems,
Yeah.
DBT could be
Oh, okay.
really helpful.
So it's not just about changing your thinking.
right.
Like-
You're right to bring that up.
Yeah, like in CBT,
Yeah.
cognitive behavioral therapy.
Yeah. It builds on that.
Okay.
It takes CBT,
Okay.
but it adds these really incredible elements
Okay, like what?
like mindfulness,
Mindfulness. Okay.
acceptance,
Uh-huh.
and something called dialectical thinking.
Okay.
You're probably...
Dialectical thinking. Sounds kind of complicated.
I know, right?
Yeah.
But it's actually pretty simple. It's
Yeah,
like
yeah.
holding two totally opposite ideas in your mind at the same time.
Hmm.
So like you can accept yourself for who you are right now.
And at the same time, you can want to make positive changes. So
Yeah.
it helps you to see like the gray areas
Okay, so
instead of getting stuck in black and white thinking.
it's like taking CBT to like a whole other level.
Exactly.
But why
Yeah.
why was it developed in the first place?
That's a great question.
Yeah.
So traditional CBT,
Yeah.
while it was effective,
Uh-huh.
it wasn't really working for everyone,
Okay.
especially people with BPD.
Right.
So Dr. Linehan, she saw that there was a need for a therapy
Uh-huh.
that could address
Okay.
those really intense emotions and the
Uh-huh.
behaviors
Yeah.
in like a more comprehensive way.
So DBT kind of emerged as a response to those limitations.
Exactly.
Right.
And the research actually shows that it's highly effective.
Oh, really?
Yeah, like
That's cool.
studies show
Yeah.
that it significantly reduces suicidal behavior and self-harm,
Wow.
and it helps to manage BPD symptoms
Yeah.
and improves emotional regulation overall.
So it's not just a theory.
Right.
It's actually
Yeah.
making a difference in people's lives.
Yeah, exactly.
That's pretty incredible.
Yeah.
What sets it apart from traditional CBT, though?
Well, a key difference is
Yeah.
the emphasis on both change and de-acceptance.
Okay.
So you're not just working to change like unhelpful behaviors.
Yeah.
You're also learning to just accept yourself
Uh-huh.
and your experiences,
Okay.
even the tough ones.
So it's about finding that balance
Exactly.
between changing
Yeah.
and accepting.
Yeah.
Okay.
So you're working towards a better future.
Right.
But you're also accepting where you are right now.
That's really interesting.
Yeah.
But I think it's time we take DBT
Okay.
out of the theoretical
Yeah.
and bring it into the real world.
Okay.
Can you give us an example of how DBT has helped someone?
Absolutely.
Okay.
Let's say we have someone named Alex.
Okay.
A young adult who is struggling with both self-harm
Okay.
and anxiety. So their emotions just feel totally overwhelming,
Right.
and they haven't found healthy ways to cope.
Okay. So how would DBT
Yeah,
help Alex?
with those struggles. First, DBT would help Alex to identify like what their triggers are.
Okay.
You know, the things that lead to self-harm
Right.
and the anxious thoughts that just spiral out of control.
Okay.
And then Alex would learn specific skills
Uh-huh.
like distress tolerance
The stress tolerance.
to help manage those difficult moments
Okay.
without resorting to self-harm.
So distress tolerance, that sounds like a pretty useful skill for like anyone,
It is.
not just
yeah.
someone who's struggling with self-harm.
Exactly. DBT teaches you how to like ride the wave
Okay.
of those difficult emotions without making things worse.
Okay.
It's kind of like learning to surf.
Oh, I like that.
Yeah.
So instead of trying to like
Yeah.
eliminate those uncomfortable feelings,
Exactly.
DBT teaches you how to handle them in a healthy way.
Right.
Gotcha.
And for anxiety,
Yeah.
DBT can help Alex learn mindfulness techniques to help them stay present and avoid getting caught up in all those what-if worries.
Right. So DBT is giving Alex like a whole new toolbox to handle those intense emotions, whether it's the urge to self-harm or the anxious thoughts that just take over. But what does DBT actually look like in practice? If Alex decided to try it, what would they expect?
Well, DBT usually involves like 3 main components. Individual therapy, group skills training, and phone coaching. So it's like...
So it's a 3-pronged approach.
To learning and applying these skills.
So let's break down each part. What happens in individual therapy?
So in those sessions, Alex would work one-on-one with a therapist to set like personal goals.
And figure out how to use those DBT skills in their daily life. So it's all about making the skills practical and relevant to Alex's specific challenges.
So it's really tailored to the individual's needs. What about group skills training?
Oh, that's
what happens there?
That's where the magic happens.
Really?
It's like a superhero training montage. Where everyone learns and practices those 4 core DBT skills.
Hold on. 4. We've only talked about mindfulness and distress tolerance.
I know.
There's more.
There's more.
I'm intrigued. Tell me more about these DBT superpowers.
I'd love to. But I think that's a perfect place to pause.
Oh, come on.
We'll come back.
Fine.
And we'll dive into emotional regulation and interpersonal effectiveness.
I can't wait.
Stay tuned.
So we're back.
We're back.
And I'm ready to learn about those other 2 DBT skills.
Emotional regulation and interpersonal effectiveness.
You got it.
They sound like pretty important life skills.
Valuable.
Not just therapy tools.
For sure.
So emotional regulation. What's that all about?
Emotional regulation is about understanding and managing your emotions in a healthy way. So instead of your emotions like controlling you, you learn to become the conductor of your emotional orchestra.
Ooh. I like that.
Right.
But how do you actually become
so
the conductor?
It starts with like recognizing your emotions as they come up. So like, what are you feeling? What triggered this emotion? And once you understand it, you can then choose how you want to respond instead of just reacting.
Right. So it's about creating that space between feeling and reacting.
Exactly.
Like we were talking about with mindfulness.
Mindfulness plays a big role in emotional regulation. Because it helps you to observe your emotions without judgment, which then allows you to make conscious choices about how to respond.
That makes sense.
Yeah.
But what if you're feeling like completely overwhelmed by an emotion?
That happens.
What are some techniques?
There are some.
For regulating those really intense feelings?
EBT offers some really cool techniques.
What?
One is called opposite action.
Opposite action?
It's kind of counterintuitive, but it basically involves doing the opposite of what your emotion is telling you to do.
So, like, if I'm feeling anxious and I want to, like, isolate myself, the opposite action would be to reach out to a friend.
Exactly.
Or go for a walk or something.
You got it.
That sounds...
It sounds strange.
Yeah, kind of strange.
But by acting opposite to the urge, you can actually change the way you feel.
So it's about breaking those negative cycles that we sometimes get stuck in.
Exactly.
Are there other techniques for emotional regulation?
Absolutely. Another one is problem solving.
Problem solving.
If you're feeling overwhelmed, ask yourself, what's the problem that's causing this feeling? And what can I do to solve it?
So if I'm feeling stressed about an upcoming presentation, instead of like getting stuck in the stress, I could like break down the task into smaller steps. And practice my presentation and ask a friend for feedback.
Exactly. By taking those steps to address the problem, you reduce the intensity of the emotion. And you feel more in control.
That makes sense. So we've covered mindfulness, distress tolerance, and emotional regulation. That brings us to the last DBT superpower. Interpersonal effectiveness. What's that all about?
Interpersonal effectiveness is all about building and maintaining healthy relationships. It's like having a toolbox
Oh, I like that.
Filled with skills
Okay.
to navigate those tricky social situations that we all encounter.
That we all encounter, yeah.
Yeah.
What kind of tools are in this toolbox?
Well, one essential tool is assertiveness.
Assertiveness.
Being able to clearly communicate your needs and wants, but also respecting the needs and wants of others.
So it's about finding that balance.
Yeah.
Between being a pushover and being aggressive.
Yeah. You don't want to be either of those.
Right.
It's about advocating for yourself in a way that's respectful and effective.
Okay.
Another key tool is validation.
Validation.
That sounds important.
It is so important for any relationship.
Yeah.
Validation is about acknowledging and understanding another person's perspective, even if you don't agree with it.
It's about saying, hey, I see where you're coming from, and your feelings are valid.
So it's about creating that feeling of being heard and understood, which is
so important for building trust and connection.
Right. Because when you feel heard and understood, it's easier to work through conflicts and find solutions that work for everyone.
Exactly.
Okay, so we've got mindfulness, distress tolerance, emotional regulation, interpersonal effectiveness.
You got all four.
Those are like the...
Like superpowers.
Yeah, the DBT superpowers for navigating life.
Absolutely.
And building stronger relationships.
I couldn't agree more.
They're pretty awesome.
And the best part is anyone can learn them.
Really?
Yeah.
That's encouraging.
It is.
Is there anything else that makes DBT stand out?
You know what's really fascinating about DBT is that it goes beyond just symptom reduction. It's about personal growth and transformation.
Okay.
It really empowers you to take control of your emotions and create a more fulfilling life.
So it's not just about surviving.
No.
It's about thriving.
Exactly.
Okay. So we've covered a lot of ground today.
We have.
We've explored the what, the why, the how, even the superpowers of DBT.
Yeah.
As we wrap up this deep dive.
Yeah.
What's the one key takeaway?
Oh, let me think.
You'd like to leave our listeners with?
I want to leave you with this thought.
Okay.
What if you could learn to ride the waves of your emotions instead of feeling tossed around by them?
That's good.
Right?
That really captures
it does.
The essence of DBT.
Yeah.
That feeling of empowerment and control.
DBT is not about like eliminating your emotions. Yeah. It's about learning to experience them fully without judgment.
Okay.
And then choosing how you want to respond.
So it's about becoming the captain of your emotional ship.
Exactly.
That's a journey.
Yeah.
Worth taking.
Absolutely.
All right. So we're back for the final part.
Part 3.
Of our deep dive into DBT.
Yeah.
You know, I'm still thinking about those 4 core DBT skills.
Yeah, those are.
It's like having emotional superpowers.
They really are.
Yeah.
And you know, that makes me think,
oh, yeah.
We've talked a lot about like what DBT is and how it works.
Right.
But I think it's important to emphasize why.
Okay, the why.
Yeah, why DBT?
Why is it so popular?
Yeah, why has it become so effective?
Yeah.
I think one reason is its focus on validation.
Validation, okay.
Yeah, DBT recognizes that everyone's experiences are valid.
Okay.
Even if those experiences seem irrational or extreme.
Right.
And it's really about creating a space where you feel heard and understood.
So it's like that feeling of being seen and accepted for who you are.
Yeah. It can be really healing.
Yeah.
Just that in itself.
I think we all crave that.
Oh, absolutely.
That feeling of being seen and accepted.
And you know, DBT doesn't shy away from the hard stuff.
Right.
It acknowledges that life can be really painful.
Yeah.
And that everyone experiences difficult emotions. So instead of trying to avoid or suppress those emotions, DBT teaches you how to move through them in a healthy way.
So like riding the waves.
Exactly.
Not getting swept away.
Don't get swept away. Yeah. Ride the waves.
What else?
Another reason DBT is so effective is that it's so practical.
Okay. Practical. How?
It's not just about like talking about your feelings. It's about learning concrete skills you can actually use in your daily life.
So it's like that toolkit.
It is a toolkit. Yeah. You can take it with you.
That you can take with you wherever you go.
And the other thing that's great about DBT.
Okay. What's that?
Is it's not one size fits all.
Okay.
You and your therapist, you work together to figure out which skills will be the most helpful for you and how to apply them.
So it's really about figuring out what works for you.
Exactly.
Not what works for everybody else.
It's personalized.
That's really cool.
It is.
So as you practice these DBT skills,
you start to see yourself differently.
Okay.
In what way? You build confidence.
Okay.
You start to believe that change is possible.
That's pretty powerful.
It is.
We've learned so much in this deep dive.
I know, it's been fun.
As we wrap up, what's one final thought you want to leave with our listeners?
I think it's important to remember that DBT isn't just for people with severe mental health diagnoses.
Right.
It's really for anyone.
Anyone.
Yeah, who wants to build a stronger relationship.
With themselves.
Yeah, with themselves.
And their emotions.
And their emotions.
So it's for anyone who wants to feel more empowered in their lives.
Exactly.
If anything we talked about today resonated with you, we encourage you to explore DBT further.
Definitely.
It might just be the key.
Yeah.
To unlocking a more
fulfilling,
emotionally balanced life.
Exactly.
And that's it for our deep dive into DBT.
Thanks for having me.
Thanks for joining us.
Yeah.
And until next time,